by bit, I'm going to show images of HIV encephalopathy or HIV encephalitis. And this is caused by direct infection of the microglia by the AIDS virus. It was previously called HIV dementia, and another term that's used is HIV-associated neurocognitive disorder, or HAND. And the symptoms can vary from mild to severe. On imaging, you can see white matter hyperintensity with sparing of the subcortical U fibers, without mass effect and without enhancement. And in the late stage, when the symptoms are more severe going to dementia, you can also see atrophy. And this is an image of a 27-year-old HIV patient with dementia, as it was then still called. And on histology, you can see microglial nodules and multinucleated giant cells, which are the hallmark of this disease. The microglial cells are very interesting because they are not derived from neural crest cells, but they migrate into the central nervous system from the yolk sac very early during embryogenesis. And I've added this micro-CT image from an 11-day-old mouse embryo, where you can see the yolk sac surrounding the embryo, and the yolk sac gives rise to progenitors of several blood cells, and one of the progenitors gives rise to the microglial cells that migrate into the brain parenchyma. And the microglial cells arrive very early in the brain, even before the astrocytes and the oligodendrocytes are formed. And these are images which show how the microglial cells enter the CNS. This is again an 11-day-old embryo, so the same age as the micro-CT image on the previous one. And if you've seen the vlogs about the malformations about cortical development, you might recognize some things, because these show the meninges between the lines. Then you have the cortical plate, so that's the precursor of the cortex. And below is the ventricular zone where the proliferating neurons are. And the microglial cells have been stained with colony stimulating factor 1 in red, and the other cells are colored blue. And on day 11 you can see the microglial cells migrating into the meninges. And on day 15 in the supratentorial brain, you can see the meninges here and the ventricular zone below. So the microglial cells have already entered the cortical plate and migrated all the way up to the ventricular zone to mingle with the migrating neurons. And the same happens in the infratentorial brain that you can see here. Images like this have been shown in the embryology of the posterior fossa, where you can recognize the rhombic lip and the fourth ventricle, and also a lot of microglial cells migrating in the posterior fossa. Typically, when there's HIV encephalopathy, there is hyperintensity of the white matter without mass effect and without enhancement. And I said the microglial cells are very early kind of immune blood cells that have migrated into the central nervous system. So they resemble macrophages, and the virus can hide in these microglial cells to escape the host's immune response and to escape the antiretroviral drug treatment. And this patient had classical HIV encephalopathy in 2018. In 2019, there was cognitive decline with worsening of the white matter hyperintensities. But you can also see that there is perivascular enhancement, which is not typical of HIV encephalopathy. And this is caused because the viral load in the CSF is much higher than in the serum. And the virus is in the brain to escape the host's immune response. So this causes the enhancement and the worsening of the symptoms. So after changing the antiretroviral drugs, the symptoms and the MR improved. So the HIV virus can escape the host's immune response by hiding in the microglial cells. And this is one of the problems why you can never get rid of the HIV virus, even with good antiretroviral therapy, because they're the microglial cells that maintain the infection. And I've said several times there's sparing of the subcortical U fibers in HIV encephalopathy, and that's a very important thing to pay attention to, because this is not the case in something that's in the differential diagnosis and that we are going to discuss next time, which is progressive multifocal leukencephalopathy.